like to take this moment now and welcome our first guest, Dr. Stephen Willey, founder of YouPlus Health. Doctor, good morning.
Good morning. How are you today?
We're great. How is it out in Missouri? You getting hit by some of the snow?
Actually, it's sunny in mid-20s right now, so we're pretty happy.
I'll tell you, we're in Atlanta, Georgia, and this town gets a little scary at times. So we're gonna get locked up here, I think, in the next couple hours. So it's I think this major storm is gonna inch its way down here. But anyway, enough about the storm. Tell us about what you're doing with YouPlus Health. You know, some interesting things with this happening. You know, tell our audience more about who you are and what you're doing.
Well, I'm a practicing physician for over 20 years. I did my medical school at Northwestern and all my postgraduate medical training at Stanford. And coming into practice, it didn't really take long before you realize there's so many things that happen to people that just never had to happen to people. But there's just not a lot of mechanisms out there to keep people healthy, to make at-risk people healthier, and to prevent all the sort of things that we all want to prevent, let alone feeling better and looking better now. And so part of the mission was to find out, what does the data really say? What is reality? You know, what is not charlatanism, but what is fact? And so, you know, working with a team of behavioral psychologists and other physicians and MIT-trained engineers, we came up with YouPlus Health, which is very different in the sense that we're not a calculator, counter, or tracker solely. We take information and actually make it doable, meaningful, sustainable, and actionable on an individual basis. We understand that there are some folks who's, you know, just getting them to walk 5 minutes a few times a day is a victory. There's also people ready for full-on personal training. There's people who are really ready to change their diet. There's other people who are just eating better at a fast food restaurant as a victory. And so we wanted to take a system that can conform to every single individual and then help them to achieve whatever that person's maximal and doable potential is.
And Doctor, you talk about
areas of fitness, nutrition, and sleep. But the other really important thing is those things aren't three silos. The data really says that what you do in one area really affects what you need to do in the other areas to be most effective. And so that's, you know, part of the approach we take as well.
Is this, Doctor, is this what you talk about as around contextual health? I mean, explain that to our audience.
Contextual health is really, again, what makes us different, in my opinion. Have you ever bought something for your kid as a gift, and you have to put it together? We all know the nightmare of how that can feel sometimes. But let's say you took the box, you dumped all the parts of the box out onto the floor. That's kind of what data is. It's all the information. It's everything, you know, that people may or may not want. But what do you do with it? Contextual health is like the instructions that would go to that toy that you jumped out on the floor and had to put together. Data is good. It's exciting in the beginning, how many steps you did or whatnot. But then we know from all the information about what really makes people healthy, we need to do more than that. We need to actually make it meaningful to, A, each individual and what their particular life situation is, but B, also make it actionable where you actually know what to do about it. There are lots of things out there that may say, hey, you slept 4 hours and 59 minutes last night, so sleep more tonight. That's great. But how? What in my life can I change? What in my life can I do to help make it better? And that's really what contextual health is, putting it into the individual's own sphere and make it actionable.
So Doctor, this actually would tell me, let's say I'm not getting enough sleep. It's not just going to tell me that, but it's going to give me some suggestions on what I can change to improve my sleep patterns?
Exactly. And it's going to be things that really pertain to your life. Part of what we do is we simply ask you questions, one or two a day, oftentimes. And so it's very similar to what anybody would do as a practitioner in their office. I'll ask someone a question, they'll give me the answer, and then based on what the answer is, I'm going to give them the best possible advice that I can. And so sometimes just that simple of an interaction is something that's important, and that's also part of how we help you with that. Again, it's very quick, very easy, just a matter of seconds, for the person to do. But exactly. Well, in that particular case, we may do something, say, with the person's pre-bed routine. Sometimes, you know what, they get up and, they have the hall light on. And so, you know what, instead of the hall light, why don't you have a night light on out there if you have to go and, take care of something in the other room, if you have a child or something. So it can be even that specific to folks in terms of it, and that is a very simple, easy example. But sometimes the things are more complicated. Sometimes they're that easy.
Yeah. So you've explained well that that your app is addressing a void, which means that we're not getting enough context around our health data at this point. What are the implications of people not being provided with proper context around their health data?
The implications are a continuation of what we've seen the last 50 years in terms of a failure of our country as a whole to get healthier, to really make the sort of progress that we need for all of us as individuals, but also as a society to be able to be sustainable in terms of cost-wise, economic, and all the other implications that come along with it. I suppose to put it most simply, it's the implications are a continued lack of results.
So when you look at the employer market that represents 160 million plus plan participants and consumers, how can employers integrate? And they're really trying to wrap their arms around doing wellness better. And I use that as a very general term. I mean, how can employers integrate contextual health into their health and wellness programs?
I think they need to have a structure in place for that to happen. YouPlus Health, our program, we do that via an app in an integrated way, but they could also do it through various health coaches if they wanted to do it. But it has to be more than just data. And, saying you walked X amount of steps, you slept X amount of hours, we had you go get these labs, and it showed this, go see your health provider. It has to be more, again, to the person's own life, and every employee is different. The person, at one part of the company may be different than the other, may be different in the cubicle next to each other. And I think that until there's a mechanism in place to recognize the individuality that people have, we're not going to be able to do as well as we can do.
Can this work in conjunction with some of the wearable programs out there? With wearables?
Absolutely, okay. Because again, I'm not anti-data at all.
No,
what I am is take the data and make it useful, make it actionable, and so data is good. We will be integrating with the Fitbit and Jawbone and all the other sort of devices. But again, we put that into context and to really get what the data says is the best way per unit time to get results. And it is true that in the medical literature, there are things that are more effective per unit time than others. And let's face it, in terms of employees, we're only going to be able to get so much time in terms of getting them to do what everyone would like them to do. And so why not get the most bang for the buck for the time that you do get? And that's a big part of contextual health as well.
So what's your current business model for the app?
Our current business model is right now that we're a free app. We're focusing on consumers because I think, and whether it's from employers, whether it's from physicians recommending to their patients, which are all avenues that is part of our business model, ultimately, if the consumer is not happy, if the consumer is not engaged and not using it, it doesn't matter. And so, a lot of philosophy has been start B2B first, and then think about the consumer. We're doing the exact opposite way. We're starting with the consumer initially, and then going more of the B2B model. So, we've listened to around 25,000 beta users, and have really learned a lot. You have to listen, and the algorithms to do all those things that I mentioned to you are not easy. I mean, these MIT guys are pretty smart guys, but nonetheless, it takes them some time to do that, and so we're honing that in our go-to-market product that is really the development of all those things in the next month or so. We're very, very proud of. We love our beta, but we've got so many better things coming.
When did you first introduce this app?
It first came out in beta form in the term that you would get out there now, probably in about August or September. In terms of this particular version. We had some very rudimentary versions out first, simply to tinker with, but in terms of actually letting anyone see it or use it, has been, again, just in the last 4 or 5 months or so. And we are really, right now, we've got those numbers pretty much on word of mouth. People like it. People tell their friends. And so that's something else we're really excited to see, because ultimately the consumer is king. And if the employer wants to give it to their employee, the person has to like it. And so that's really, again, what we're doing, the opposite of what so many have done, starting with consumer first, getting it where we were happy with it, and then going more the B2B and physician distributed model. And as a physician, I can tell you they have something that's trusted, that's peer-reviewed. And by the way, we just had our initial pilot study published in a peer-reviewed medical journal, basically a good place to be for a mobile health product. And we had fantastic results that are actually published. So I think that's the other thing that we really want to distinguish ourselves, that we really are evidence-based. And again, that's anyone who's a scientist knows that's an incremental process. And you can't just do a rush to market. You have to do it right. And so that's why we've taken our time getting to where we are. But now that we're just about there, we just couldn't be more excited.
No, that's great. And Doctor, anyone can find this on the App Store. Is that correct?
Yes. But again, what they're going to see now is our beta version be very different in a month or so from now. But on the App Store, it would be YouPlus, all one word, YOUPLUS, then Health, and or Google Play. And on our website, it's again YouPlus, all one word, .com, and they can find out a lot more from that aspect of our website, youplus.com as well.
Well, that's fantastic. I like what you're doing. I'll actually go download it later this weekend.
A passion of our team, and this whole thing was really born of a passion to change things. Just as a physician, you young doctor going in the emergency room, you have the 45-year-old patient who passed away from a heart attack, and the person's family there obviously distraught and terrible, and those things just don't have to happen. And so it was really a desire to change things for the better, and a passion which led to this whole project, which again, just for the team, has made it so meaningful.
Well, Doctor, we really appreciate you joining us on the program. We've got about 30 seconds to go. I'll give you an opportunity to leave our audience with one or two takeaways, if you would, please.
I think takeaway number one is context. Throwing all the parts of the toy on the floor, but the instructions to put it together is really what you need. You need to have something that's individualized that can coach each person from wherever they are and meet them wherever they are to whatever that person's potential is. And I think it's also important to know that fitness, nutrition, and sleep really integrate within each other. And looking at each of them as three silos is also doomed to not be as effective as understanding how all three of them integrate together.
Fantastic. Dr. Willey, appreciate you joining us on the program today, and let's stay in touch. We'd love to follow the continued evolution of the YouPlus Health app. And you have a great weekend, okay?
And greatly appreciate your time.